One other thing I want to make sure that we hit on is Medicare Advantage. We're hearing more about the Medicare Advantage. Can you just talk us through some differences between original Medicare and Medicare Advantage? Because it seems like there's some misconceptions there.
Yeah, absolutely. And I'm sure everyone's aware, they've seen the Joe Namath commercials, and you can get your extra benefits and things like that. So it is really important to understand the differences of original Medicare and Medicare Advantage. And this is really what confuses people, because they're two totally separate ways to get Medicare. Original Medicare is where you have a hybrid of the government insurance, so Part A and Part B. Part A is hospitalization. Also, skilled care falls under Part A. And then Part B is what's called medical. So that's going to be really everything outside of an inpatient hospitalization. So your primary care doctors, your specialists, surgeries, lab work, MRIs, X-rays, things like that.
Right.
But there's gaps in Medicare Parts A and B. For example, Medicare Part B will only cover the first 80% of your claims. So you have a surgery, it's $10,000. Medicare Part B is going to pay the first $8,000 as an example.
Right.
Then you want to add on a Medicare supplement plan to cover that 20% gap. So your Medicare supplement plan is through an insurance company, and that comes in and pays that $2,000 gap in the example that I just mentioned, or the 20%. That's going to be an uncapped amount. So whether it's $10,000 worth of medical bills or $1 million worth of medical bills, these Medigap plans are designed to come in and pay that 20%. They will also, some plans pay the things like the gaps in Medicare Part A. So for example, hospitalization, there's a deductible of $1,600. Your Medicare supplement plan comes in and pays that $1,600 for you. It will also pay, depending on what Medigap plan you choose, most plans will also pay any hospital or skilled care daily copays. Finally, then you add on a prescription drug plan. Again, this is really where you want to look at, okay, what prescriptions do I take on a regular basis? And you want to shop trying to find a plan that covers those prescriptions in an optimal way. Again, something you'll review each year. One thing to mention is Medicare supplement plans are all standardized. So they have to be identical from one insurance company to the next. So we definitely want to look at pricing, who has been competitively priced in the market. We also want to go with very strong companies with their financial strength rating, so A or A+.
Colin, have you seen variation there with pricing year over year, insurance company to insurance company?
Yeah, it's really based on age and location. So in certain locations, one carrier might be more competitive than another carrier in another location. It's really kind of where the carriers want to make a play to be competitive and have a lot of business in those areas. They're looking at, where were our claims good? If their claims experience is good, they might have lower premiums in that area. Again, the prescription drug plans, there's about 25 to 30 plans in every county. So we really want to look at, okay, what prescriptions am I taking regularly, and how can I have those covered in an optimal way? Now, Medicare Advantage is where you would essentially give up your Medicare Part A and Part B benefits, and you would transfer all of your Medicare coverage into one plan with one insurance company. So Medicare Advantage is a totally privatized version of Medicare. So as an example, for let's just say Blue Cross, you go with the Blue Cross Medicare Advantage plan. Blue Cross is your sole carrier. They're managing your care. They're managing your claims. Each Advantage plan has different out-of-pocket costs. So they have different deductibles, co-pays, co-insurance for different services. So whereas original Medicare is very standardized, very set, Medicare Advantage really varies widely from each plan. So Blue Cross's plan is different than a United Healthcare plan, which is different than a Humana plan. So some of the things that you want to make sure that you're aware of with Medicare Advantage is they are network-based plans. Because remember, now you're with one insurance company, and that insurance company has deals with different providers. So if you choose Medicare Advantage, you want to make sure, you want to check, are my doctors in network? Will my doctors accept my Medicare Advantage plan? Do they take Blue Cross? Do they take United Healthcare? Just to name a few carriers. Whereas original Medicare does not have any networks of doctors. So original Medicare, you have more flexibility throughout the country to go to any doctor that accepts Medicare. And that's going to be true of both the supplemental plans, and then the prescription plans is different pharmacies.
Colin,
So
have you seen trends, sorry to jump in terms of the last 5 years, even the last 3 years, the individuals that are on Medicare utilizing original Medicare versus Medicare Advantage? Where have things been trending over the last few years?
Medicare Advantage enrollments are definitely very up year over year. What attracts people to Medicare Advantage is they're very low cost. So there's a lot of zero premium Medicare Advantage plans. They add things like dental and vision, which original Medicare does not include. Some of
Right.
them have gym memberships. Some of them even will have like transportation to doctor's appointments and things like that. So Medicare Advantage, they have those sweeteners that the insurance companies provide to beneficiaries. But again, the trade-off is you could have higher out-of-pocket expenses when compared to original Medicare, so lower premium, potentially higher out-of-pockets if you're using it. Also, the other trade-off is networks of doctors. So you're now navigating an insurance company's network of doctors. Original Medicare, you'll pay a little bit more in premium because you're adding on a supplement plan and a drug plan, which have premiums attached. But your out-of-pocket costs are typically lower and they're more predictable. And then you don't have to navigate a network of doctors. So it's different strokes for different folks. Some people, they are attracted to a lower premium plan. They're okay knowing that, if they go to the hospital, they're going to get a bill. If they need ongoing care, they may get some more bills.
Yeah.
They're okay with navigating networks of doctors. Other people, they don't want to have to navigate a network. They'll pay a little bit more in premium, but they can see any provider they want. They don't have to jump through any hoops, virtually no claims, and very low out-of-pocket costs.
That's great.
Thank you for watching our video. Please remember to subscribe to our YouTube channel. Look at our links below for ways of getting in contact us, and message us if you'd like us to add you to our monthly newsletter.